Doctor Says 360.
Hi, my name is Dr. James Cobb. I'm an ENT specialist. Some patients will ask me, does excessive earwax cause vertigo? Generally, I would say no. It's very rare for excessive earwax to cause dizziness. But bear in mind, certain ear infections like perforated eardrums, cholesteatoma can also cause dizziness. So you have to be aware of that. If you have any ear pain, ear discharge, presents with dizziness as well, so you need to go and see a doctor urgently. Can you recover from vertigo completely? I would say most of the time yes, with the right diagnosis, with the right treatment, and most of my patients do recover. So is there any specific food that can trigger vertigo? So yes, the answer, especially if your vertigo is caused by migraine or Meniere's disease. In fact, migraine and Meniere's disease are very similar. They both have comes and goes. They can, and usually they come and go because there is a trigger. And one of the common trigger for migraine and Meniere's is certain food. And what type of food are very common? Such very commonly we call the 3 C's: cheese, chocolate, and coffee. Of course, there are other food that can trigger, not necessarily these three. If some patients, if they, for example, food high in salt, high in sugar, high in MSG. So you may notice like, I get dizzy if I eat out. We had a fried rice that day. So sometimes I do ask patients, when you have a dizzy attack, migraine attack, what did you eat on that day? What did you eat the night before? Even drinks can sometimes trigger, such as just now we mentioned coffee. Other drinks even, it can be anything like fizzy drinks, carbonated drinks, can also cause dizziness. So besides food, also there can be other triggers, such as stress. More commonly, I see in my practice stress, not sleeping well, sleep disturbance. They sleep but they keep waking up. Other thing very common, in fact, neck pain, shoulder pain, so poor posture, pain. So this again, I sometimes refer to my physiotherapy colleagues. Other than that, hormonal changes. That's why more common in females during near or during menses, or postmenopausal or premenopausal females. Usually they will notice more episodes of migraine. Other thing is also intensive exercise, dehydration, not having regular meals. So all this can also sometimes trigger vertigo attacks. Of course, in this case, Meniere's disease or migraines.
Doctor Says 360.
If you like our channel, please like, share, and subscribe.